Well, hi there and good afternoon. Thanks for joining us again for today's Daily Update. My name's Dougal Saunders, joined again today by Scott McLaughlin, Chief Executive of the Western New South Wales Local Health District, and again today by Assistant Commissioner Brett Greentree from the New South Wales Police Force. Now, I'm starting off with some good news today for 5 local government areas across our region that'll be released from stay-at-home orders in an hour. 1 o'clock today, stay-at-home orders no longer apply for Blaney, Bogan, Cabonne, Forbes and Parkes. So some good news for those local government areas. For the rest of the region, if you are in stay-at-home orders, you will remain in stay-at-home orders for at least another week. And on a weekly basis, those numbers, cases and all the scenarios will be checked and analysed to look at other local government areas to come in or out. Up until 8 o'clock last night, 27 new cases of COVID-19 across the district, and that's a bit of a reality check after we were back at single digits yesterday. Scott might have a bit more thoughts around that. Dubbo local government area in total 13, that includes 1 case at Wellington. Bathurst 6, Walgett 6 and Bourke 2. So the health district total is now, as a cumulative total, 1,024, and Dubbo 735. For the Far West today, another 2 cases, both at Broken Hill. 335 people currently being looked after in the COVID Care in the Community program, which has been such a great success. 38 extra people have been discharged in the last 24 hours, so no longer infectious, no longer requiring care, and over 600 have now been through that program. Now, from the cases that we currently have today, the 27 new cases, 6 have been infectious in the community, we know, 3 for more than 2 days in Dubbo and Bourke, 7 isolating and 14 are still being investigated. And Scott will have more details about the linkages, but also some sewage detection, which has popped up, and there are a few concerns around parts of the region on that. One of the myths I just wanted to debunk quickly today that's been popping up on social media is around mask wearing. Now, it's become apparent that some people think that there's been a relaxing of a rule around masks. That is simply not the case. Let me assure you, masks are remaining as mandatory. The reason I think people have thought that something has changed is that the mask order was a separate health order for a long time. It has now been taken into the overall health orders. It is still listed as a health order. It just isn't its own separate health order anymore. So, look, there's been a lot of speculation around that. Please be aware, masks do remain mandatory. Our testing, unfortunately today, lowest for quite some time at just over 1,700 for the district, 950 of those were in Dubbo. But today we are announcing some more surveillance testing, and I think this is a really good move, and Scott will have a bit more detail, but look, a bit of that is being driven by the positive sewage detections in parts of the region. So surveillance testing will be running at Trangie, at Lightning Ridge, Mudgee, Forbes and Cowra from today. Trangie MPS is running a drive-through up until 3 o'clock this afternoon. Scott will have more details about the other sites, but essentially surveillance testing is one of the things that we are looking at as being a really encouraging way of asking you to come forward and get tested. So basically what that means is you can come forward and get a test and you do not need to isolate unless you have symptoms or you've been a close or casual contact or in close contact with somebody who has been. So we need you to do the right thing. This is about maintaining testing numbers and making sure we're testing as many people as possible, not inconveniencing you, but if you have symptoms, if you have concerns, you really do need to then isolate. If not, carry on. You still need to follow stay-at-home orders, but you can be back at work and doing what you need to do in a responsible way. Now, that surveillance testing in those areas starting today. From tomorrow, that will expand to Dubbo, to Bathurst and also to Bourke. So in each of those communities, we will be encouraging you to come forward, symptoms or not, and actually get tested so that we can try and stay ahead of the game on that front. Vaccination, of course, is also playing a massive role in our way out of this. So Dubbo at the Regional Theatre and Conventions that are still running second dose clinics right now. That'll be right through until Sunday. You should have had your text message with your appointment time. Please make sure you're turning up. Parkes ADF clinic second doses finishes today, and then right across the region, Warren starting tomorrow. That also runs for a day, Peak Hill tomorrow, Trangie and Forbes on Saturday. So heading out across the region as those clinics did 3 weeks ago. They're back for second doses now. There's a link on this post with all the details of each town and when that clinic will be back in your part of the region. So keep an eye on that and make sure you're taking up that opportunity for your second dose. Take your Medicare card, take your individual health identification number if you have that, take a couple of forms of ID as well, and make sure you get that jab. A bit of news from West Haven as well, which is running a special Pfizer clinic in Dubbo for next week, Monday to Thursday at West Haven in conjunction with Aspen Medical. And this is available for people that are living with a disability, disability workers and volunteers, but also people experiencing homelessness or living in emergency accommodation. So this is a really good initiative. And again, we've got some follow-up vaccination clinics coming up in October for that particular one. Full details and a link to how to book for that are on this post. So if you or somebody else you know needs that sort of a clinic as well, we really want you to make sure you have a look at the post and book online for that one starting next week. Wellington Vax Clinic still running second doses as well. AstraZeneca still available at WAX and also at the Swift Street Medical. Mudgee Vax Clinic, just to remind you, they're running a special weekend for school-aged children, so 12 and up this coming weekend for all of the children 12 and over in the Midwestern regional area. Bookings 6362 4031 or at the South Mudgee Surgery for details there. So lots and lots of opportunities to get a vaccine. If you can't with the ADF clinic, look at the other opportunities. There are so many through GP clinics and pharmacies. We really want you to be involved. I'll hand over now to Scott for his health update.
Thanks, Dougal. Well, today's a really stark reminder for us how COVID can be creeping around any of our communities with significant increases on the numbers from yesterday. To see 27 new cases in the last 24 hours. While some of those are household contacts and close contacts, we're still seeing a significant number that aren't linked and people infectious in our communities. And so I'd say it'd be very premature for us to think that we've got in front of this current outbreak. We know that we've also passed another milestone of having 1,000 cases in total in this outbreak in Western New South Wales. Now, that's 1,000 people and lives impacted in our region significantly by COVID, with real potential for further spread across our region. So please, everyone, don't be complacent around this, whether you've moved out of lockdown in the next couple of hours, whether you're still in lockdown, our behaviour and our reaction needs to be the same. We know that any day of the week, COVID won't discriminate between you, me, our brothers, sisters, aunties and uncles in all of our communities. So things will continue to evolve in the region. We're stepping up and changing a few things to help us get in front of outbreaks, as Dougal's talked about, some surveillance testing to help us identify much earlier when we have COVID in our communities with some of the other tools that we've got at our disposal. And I'll come back and talk about that in more definite details. So as Dougal mentioned, some LGAs coming out of lockdown in the next couple of hours across Blaney, Bogan, Cabonne, Parkes and Forbes. Can I please say to those communities, this is time for some of the stay-at-home orders to be adapted to give you some more freedoms, but it's also time to maintain all of the things that we know are going to have to be crucial in coming weeks and months to keep us all safe. So please, everyone, look after each other, care for our community and some of our most vulnerable in that. Some good news. The Australian Defence Force has now confirmed they'll be staying around in the region for longer to help us lift the vaccination rates and get to all of our communities, and particularly some of our vulnerable members in our communities. So right through until the end of October. Dubbo this weekend will see a Super Student Saturday with the 12 to 15-year-olds really in focus, and so I really would encourage parents to bring your kids and teenagers along to that clinic on the weekend. That will continue right across the region. Some of the clinics are for second dose only, with a further expansion of a lot of those for new people to walk up into those clinics. Our vaccination hubs in Dubbo, Orange and Bathurst continue to be available, and so please look out for those vaccination opportunities coming up. So 27 new cases in the last 24 hours to 8 p.m. last night. The details of those, 12 new cases in Dubbo, 1 in Wellington, making 13 for the local government area, 6 in Bathurst, 6 in Walgett and 2 in Burke. Now, out of those 27, 18 cases are known to be linked, either household contacts or known links with other cases. 9 are still under investigation, but we do know that out of the total 27, at least 6 were infectious in the community. And so, again, a real warning for us on any day of the week. This can be the person next to you in the supermarket, the service station, or over your back fence. We've still got quite a few under investigation, as I said. Again, a growing number of people over the age of 70, with 50 people now over the age of 70 with confirmed COVID cases. Again, the aged care facilities in Dubbo continue to be of concern, with 3 new cases identified in St Mary's Villa, taking that to 20 cases in total, with no new cases in Holy Spirit, and again, some extreme efforts going into making sure we can protect and support the residents in those locations. Again, a further expansion or increase in the number of locations identified or venues of concern across the region, with additional venues identified in both Dubbo and Mudgee. I want to call out Mudgee in particular. A venue is linked to a traveller that passed through a few days ago. So please, everyone, go to the New South Wales Health website, have a look at the details of that. If you were in that location, it's a casual contact location, and please isolate after you've had a test. Those are the crucial things for us. The sewerage testing across the region delivered a number of new locations where we haven't got active cases again. Cowra, Mudgee and Forbes. So to those communities, please, this is a real time to be vigilant. If you've got any signs and symptoms, however mild, then please come forward and get tested. But we're also expanding the surveillance testing to those locations. So from today, please, if you've got any signs and symptoms, or if you don't have symptoms in Cowra, Forbes, Mudgee and Trangie, please come forward to get tested. Now, what that means, if you don't have symptoms, you don't have to isolate unless you've been in contact with someone that has had symptoms. Please, this is a crucial step for us to try and get in front of COVID. We know that with the sewage detections, nearly every sewage detection we've had across the region has resulted in a case in that community. So absolutely fair chance there's someone in those communities with COVID right now, could be infectious in the community. Please come forward and get tested to the locations that are known in those communities. Tomorrow we'll also be moving to have surveillance testing more broadly available across a couple of our locations where we've got significant case numbers, and particularly cases that aren't linked to known cases across Bathurst, Dubbo and Burke. That'll join Walgett, that's already been surveillance testing in recent days. So again, that means if you don't have symptoms, please come forward and get tested. And you only have to isolate if you've either got symptoms or have been in contact in a household with someone with symptoms. Now, it's a big step forward in our surveillance across the region, trying to get to know where COVID is creeping around our communities, get in front of that spread before it takes off. And we'll come back in early next week with some further advice about other locations and opportunities for surveillance testing. In terms of the hospitalizations across the region, 17 patients now in hospital, 4 in intensive care and 3 of those ventilated. Of those, 7 patients are in Dubbo, 6 in Bathurst, 2 in Orange, 1 in Burke and 1 in Narromine. I just want to centre back on Bathurst for a second, with 6 patients now in the community and a significant number of active cases in the community. That's of real concern. 335 patients in our care in the community program, with another 38 discharged, and really successful program again, helping the people get through their COVID illness. 17 health workers in isolation. That number continues to be low, which is very pleasing. Tomorrow we'll see the transport of 10 motorhomes up to Walgett to support the accommodation of people either with COVID in Walgett or household contacts that need some form of accommodation and isolation from people with COVID. So we'll continue to expand that program and support for communities. Listen, I'll hand over now to Brett Greentree from Police. Thanks, Brett.
Yeah, good afternoon, everybody. From a policing perspective, about 60 infringements were issued in the last 24 hours. that has progressively decreased in the last few days, which is good, but we are still concerned about the movement of people around the place. Majority of those, about 29 within the Arana and predominantly within Dubbo, so that's a real concern. Tells me that people are still moving around where they shouldn't be and breaching the orders and therefore potentially moving the virus around our community. 4 in Barrier Police District, 8 in the Central West, predominantly Orange, and 4 within Central North, the Burke and Walgett area. 2 in particular, 2 infringements issued to 2 men last night within Walgett. We have been paying particular attention to Walgett, given some of the recent concerns there and the rise in cases. So our policing efforts have stepped up there, and they will continue. As I said, 2 infringements specifically for people breaching the orders last night. We also had an incident at Mudgee where we had at 2:30 in the morning a 25-year-old female who had been out visiting friends, drinking, or pulled over breath testing. Not only did she get charged with an allegation of driving with alcohol within her system, but also breach of the public health orders. Again, we need to say people need to stay home. Scott has alluded to the fact that we are far from through this at the moment, and the policing operation will ramp up somewhat, focusing on those hotspot locations right throughout our region as we work with our partners, health in particular, trying to get ahead of that game. In terms of the emergency management response, again, from a region level, working every day at the operations centre, and the local emergency management committees pardon me, are meeting regularly, if not daily, right across our region. The ADF, our partners and health, working closely, and I think I've said before, our wellbeing checks are far greater than what we have with infringements, and that's really pleasing. A particular focus on Walgett, Burke and the Angonia areas where we've been working very closely with our health colleagues, Resilience New South Wales and all our members of our emergency management committees, ensuring that our communities are looked after and are provided essential services and supplies as you would expect. So that's taking place daily. In terms of moving forward, from a policing perspective, we understand there are some LGAs that are coming out and have come out of lockdown. That doesn't mean you can still move around. I've instructed the police today to ramp up the stay-at-home. That's still in place, the stay-at-home operation 24/7. And whilst I don't want to see infringements issued or people charged, we will do that if you are breaching the orders. We are close to, I would say, the vaccination status of what we're all hoping for, and will allow us more freedoms. But from a policing perspective, I need to warn everybody that if you are out and about and breaching the orders, then you will receive an infringement or possibly be charged with the breach of the health orders. I cannot say it enough. I think another important stat is close to 200 vehicles stopped within the Burke, Walgett, Barrier area in the last 24 hours. Thankfully, no infringements issued, but why I'm saying that is to let you know that our Highway Patrol are working very closely with our local police in ensuring that we're stopping traffic and people who may think that they can move from a lockdown zone to a non-lockdown zone. So please, again, we need each other to support. We need to support each other. If you have friends, family that think they can breach the orders, please stop them. It's very important because if you stop the movement, we effectively stop the virus. So again, we'll continue Operation Stay at Home enforcement, whilst also assisting emergency management partners right throughout this operation. Thank you.
Thanks, Brett. If anyone has questions for Brett, could you raise your little digital hand now? Riley from the Central Western Daily.
Hey there. I just got a couple of questions. The first one, I just wanted to know if there were any stats available just for the vaccination rates for police in the Central West. Obviously, the deadline for when people is coming up. I just wondered if we had those numbers available.
Oh, yeah, absolutely. I can speak generally across the Western region. Majority of police have had their first dose of vaccination, and Central West in particular are looking at around, I believe, 3/4 of fully vaccinated. So that's very pleasing. But again, we are ensuring that we're pushing our police, again, because it's mandated by the Commissioner, and that's ongoing at the moment. But pleasing thus far right across the region, which is good.
Okay, brilliant. And the other question I had, so last week, the Premier in her address said that it was easy for workers, to police unvaccinated people, coming into their businesses, for those that are allowed to reopen. I guess my question is, have or should, businesses that are reopening be given actual training from police on how to deal with people who would refuse the orders?
Yeah, look, Roy, we're not sure how that's going to look. I know it's playing out at the moment, and we'll be guided by the government on that with regards to how that, will look for businesses. I understand, it's challenging at this present time. What I will say from a policing and certainly from an emergency management perspective, we will be doing our best to support the government as we move through the next phase. And what that looks like, I don't think we exactly know at the moment, but from a policing perspective, we'll always be looking at the public health orders and ensuring that we do our best to, educate, train, and also enforce whatever orders are put in place.
Okay, appreciate it.
Thanks, Riley. Does anyone else have any questions for Brett? Appears the answer is no. Thank you very much.
Thank you.
If you could all raise your little hands if you have questions for Dougal now. Emily from the Daily Liberal.
Dougal, just in terms of the freedoms and the possibility of opening up, if we get to that magic 70% double vaxxed ahead of the state or the state average, is that something that could prompt Dubbo, for example, opening up earlier?
No, look, that's not really the way this will work. Obviously, we're talking about a bit of a competitive nature of trying to encourage LGAs to look at similar size ones and try and get to certain numbers first. But the actual ability to try and open up earlier would be very difficult to manage, and I think would really become quite confusing. So the 70% double vax rate is for the entire state of New South Wales. It won't pinpoint any particular communities, any particular local government areas, any particular towns. It will be the statewide, and I think that's probably the best way to look at it.
Okay, and just in terms of when we do reach that statewide 70%, I understand it's sort of playing out now on the state level, but is there a working plan, I guess, or anything you can say in terms of how that is going to look in Dubbo and the regional the regional towns in this electorate? Like how is that going to work?
Yeah, look, that was released, I'm going to say this time last week or maybe Tuesday or Wednesday last week as part of that roadmap. So the 70% figure, and one of the reasons, I guess, that doing it individually on towns or LGAs would be difficult is that part of the 70% plan is a bit more ability to travel domestically, including to regional areas. So, we want that ability to happen. We want it to happen for double vaxxed people. We want to be able to support tourism and all of our fantastic food and outlets that normally would be looking forward to tourism in this next couple of weeks for school holidays, for example. It'll be a bit later than that, but we still want that ability. So that plan has been outlined. It will include, some events. It'll include people at your own home for the first time again. It'll include gatherings of, I think, up to 20 people outdoors, back at restaurants, back at pubs, the ability to gather, basically, is what it's about. Weddings and funerals, more people, things like that. But that is all part of a roadmap towards the above 80 as well. But all of the 70% details, sure, I shouldn't say all of, a lot of those broad details have been released in the past week or so by the Deputy Premier.
Thanks, Emily. Alex from ABC Western Plains.
Thanks very much, Matt. Good afternoon, I should say, Dougal. Look, this is a question that I think that, mine are talking about right now as well. At the moment, it seems that the Gilgandra Shire hasn't come out of lockdown despite not having cases for the past 7 days. I think it's the beginning of the month they last recorded a case. But the Blaney Council is coming out of lockdown despite the fact their last recorded case was just 6 days ago. Why is that?
Yeah, look, I think Scott can probably talk to more detail around the actual cases. The standard scenario is that 14 days without a case. Some cases are false cases. Some cases have moved out of that scenario of being at a certain location. Some are absolutely no risk at all, so they're not being included as a current case. In most cases, though, it is that simple scenario of 14 days without a positive case in that local government area. But each particular thing is looked at very individually, and I can tell you that for some of the places that are coming out today, there was a lot of scrutiny put on around the cases that had been there and why it was able to come out. And that's from the health district level, so certainly the team, the public health team has input, as do local members. The Deputy Premier talks to a lot of people about that, talks to then the Chief Medical Officer and the Health Minister. So there's a lot of scrutiny around why or why not, and in these cases that decision was made. Now Gilgandra has had a clear positive case, so at this point in time it isn't looking at coming out for another 7 days, I think it is, so that's pretty clear now.
Thanks.
Thanks, Alex. Ollie from Wynn.
I'm so sorry, just battling to find my unmute button. So sorry, I think I might leave my question for Scott. I think it's probably more appropriate to address that one to him, so I'll spare you, Dougal.
Thanks.
Thanks, Ollie. Joanna from ABC Central West.
Thanks. Mr. Saunders, just with regards to what your question to from Alex, based on that, then why would Forbes be released from lockdown if there's a positive sewage detection? Wouldn't it potentially face the same scenario that Yass has found itself in, coming out of lockdown and then going straight back in?
Look, it could do. That's the reality. Forbes hasn't had a positive case for over 17 days, and there's now been a sewage detection. That's the reality of what we're facing. And you could say, why let anyone out? Well, because communities do want to come out and have the ability to have a bit more freedom, a bit more ability for businesses to trade, etc. So, the 14-day is around that 2-week infectious period. And, at that point, yesterday, when the discussions were first had around Forbes, it had over 17 days. And certainly council and the community is very keen to move forward. Now, since that time, there's been the reflection of a positive sewage detection. So Forbes is possibly, if there is a case found, possibly would go back in, and that's what could happen at any time. And the Deputy Premier's been pretty clear on that as well, that we're doing what we can to try and make sure communities have an opportunity. But if there is an active case again, unfortunately, that will mean that you go back under the stay-at-home orders.
Thanks, Joanna. Laura from the Canberra Times.
Hi, Dougal. Just in terms of, there's no mentioning of Warrumbungle's LGA going back into lockdown after that case in Mendoran. From that case, are they in the clear now pretty well?
Look, that was certainly discussed pretty seriously yesterday. The case, as I mentioned at about this time yesterday, there was a case in the Warrumbungle's local government area. The case is extremely low risk. All of the tracing has been done, and that's been confirmed that really there is no risk around that case, and therefore the decision was made that it didn't need to go back in. Now, if that case had been of concern, then Warrumbungle's would have been back in under stay-at-home orders. That wasn't the case, so they remain out.
Okay, great. Thanks.
Thanks, Laura. Thanks, Dougal.
Thank you.
I think that's everyone. We'll bring Scott forward, and we'll kick off with Emily from the Daily Liberal.
Scott, in regards to the surveillance testing which you've been talking about today, can you just give us a bit more detail on exactly what is that compared to the regular testing, and where can you access it and when should you access it?
Sure. So we've triggered some surveillance testing, primarily in the locations where we've had some sewage detections go off, showing fragments of COVID in the sewage across today. Starting Mudgee, Cowra, Forbes and Trangie. And so for people in those communities, please come forward and get tested, whether you've got symptoms or not. What it means is if you don't have symptoms and haven't been in contact with anyone, you don't have to isolate after that test. If you do have symptoms, those are the things we really need people to isolate after the test and wait for those results. Now, The results are coming back in about a third of the time of what it was 2 weeks ago, so they're much quicker and much more responsive. So can I please ask everyone in those communities to come out and get tested whether you've got symptoms or not. In Dubbo, Bathurst and Burke, that will kick off tomorrow. Those are locations where we know in the last week or 2 weeks we've had people infectious in the community that also haven't been linked to other cases, and so we know that there's transmission in those locations. That's a high concern for us. We've triggered that 2 days ago in Walgett, and it's certainly been successful in helping people to get tested and helping us to lift those testing rates.
And thank you. And just in terms of the numbers, you have sort of spoken about this, but yesterday with the 2 cases in Dubbo and the 27 total today, they have obviously bounced around a bit, which you had predicted. What could you attribute that to, or what could you put that down to?
Listen, some of the increase in numbers today is household contacts or close contacts of known cases, so there's not a lot of surprise in those, so that entails 7 out of the 27. We've still got 14 that are still being investigated, so a number of those again will be household or close contacts. But what we know is there's still a significant number out of that 27 that have been infectious in the community, and so 6 definitely have been infectious in the community. The reality for us is, across a number of our locations in the region in the last week and 10 days, we've had a lot of people infectious in the community, and so we still do have spread in particularly Bathurst, Dubbo, Burke and Walgett, with sewage detections going off, particularly in Trangie, Lightning Ridge, Mudgee, Cowra and Forbes. Those locations are of real high concern as well, where we know that we don't have cases. So I guess the reality here is any of our communities any day of the week can have someone with COVID in them. With more movement because of the stay-at-home orders lifting, there's some real risk that we'll see spread in more communities across the region. So testing's absolutely crucial. Please come forward in those locations. We've announced for surveillance testing, even if you don't have symptoms, and follow some of the advice around that. If you do have symptoms across any other locations, now's the time to come forward and get tested. It could just be COVID. We don't want to risk any further spread across the community. Yesterday was a pleasing day with only 6 cases. I wouldn't expect we're going to see that for some time. We do know that we're going to see further spread across our communities with the people that have been infectious in town.
Thank you.
Thanks, Emily. Hamish from Prime 7.
Thanks, Matt. Afternoon, Scott. Scott, are you able to, are you still seeing a high number of people missing their second vaccination appointment at the ADF walk-in clinics?
Hamish, that's only been an issue in Dubbo, and it's been an issue for people that have lived outside of Dubbo, and I think have also found alternatives for their second dose. So, yes, it's been a small issue, hasn't been an issue anywhere else for us. We've followed up with all of those people that haven't attended and made sure that they've got a plan for their second dose. But what I would ask everyone is, if you're not able to attend for your second dose, whether it's in the ADF clinics, whether it's at your GP, pharmacy or other location, please ring forward ahead or respond to the text messages that are getting sent out for the ADF clinics.
Thank you.
Thanks, Hamish. Alex from ABC Western Plains.
Thanks, Matt. Hi, Scott. Look, I wanted to start by talking about the cases in Dubbo. 12 cases it's a huge, it's a big jump from yesterday, obviously. Are we looking at new clusters? What are the locations for these?
Most of those are linked and are known either in households or linked to other cases. There's, as I said earlier, 7 that are still under investigation. The vast majority of those I expect will be linked, but we do know that in Dubbo at least 3 cases were infectious in the community, and so again a warning that there'll be increased locations or venues of concern flagged, and a number of people that have been infectious in community. That's, I guess, a warning for all of us. Any day of the week, it could be you, it could be your neighbour.
Yeah, great. And I just wanted to circle back to what I was asking Dougal before. From a health perspective, how does it make sense to keep a LGA that hasn't had cases in 2 weeks today, speaking specifically about Gilgandra, but letting places like Blaney out and Forbes even?
Sure. So what we're looking at is the last date that a case has been infectious in the community. We know that there's been cases in some of those locations, in Blaney, Cabon and Gilgandra, after those last cases infectious in the community. As far as I know, that last case that was identified on the 2nd of September in Gilgandra was infectious in the community, and so that's the real consideration around that. We know in a number of other locations, like Dubbo and other places, that there's cases that are linked to household contacts that have been in isolation and haven't been infectious in the community, and so that's a part of the consideration that we're trying to take around the stay-at-home orders.
Thank you.
Thanks, Alex. Ollie from Wynn.
I've actually just had my question answered, so that's all good. Thank you.
Thank you, Ollie. Claudia from Prime.
Thanks, Matt. Hi, Scott. Just wondering if you can talk us through, I guess, what you put the sort of spike in cases to today compared to yesterday, and whether the testing numbers are still so low. Do they need to be higher? Could there be more cases in the community?
Alison, that the testing numbers were low in the last 24 hours. They're down around 1,700 people. That's a record low for Western New South Wales. The low testing numbers and the few cases we identified in the last 24 hours show there's definitely people infectious in our communities. That's what I put it down to, is that's going to continue while ever people go out of the house with symptoms and aren't getting tested. So these few people that we picked up with symptoms in the community and have been tested are pleasing. But while ever we have people out with symptoms in the community, there's potential going to be further spread. So the step up to surveillance testing will help us get in front of that, I'm hoping. I really do call out for the communities in those locations to come and get tested, even if you don't have symptoms. We want to get in front of the spread, particularly over this weekend. In Dubbo and Bathurst, there's drive-through clinics available, both Bathurst at Mount Panorama and Dubbo at the showgrounds. Those are the locations to come and get tested. The test results are coming back much quicker, but you also don't need to isolate if you haven't got symptoms or if you haven't been in contact with someone with symptoms.
Thank you. And is there anything else you can tell us about the Mudgee Traveller? I guess how long they were in the community for, and what your concerns are?
Yeah, sure. We know the Mudgee Traveller stayed overnight in Mudgee. There is one location of concern where we haven't been able to get in contact with everyone that's been at that location. And so that's a real concern. It's the corner store in Mudgee. Please, everyone, if you can look at the details on the New South Wales Health website, it's a casual contact location. So if you have been in that location, please come forward and get tested until you've got your test result back and stay in isolation.
Thank you so much.
Thanks, Claudia. Riley from the Central Western Daily.
Hey there. I know you've spoken about this previously, but since Dougal brought it up as well, about the face mask myths going around social media again. Can you just, I guess, speak to that and how harmful that might be to the community?
Austin, the one thing that we know is face masks are doing a fantastic job in stopping people picking up COVID and spreading COVID. And so the same restrictions still stay in place. When you leave your home and go outside, you need to have a face mask on, with the exception of a couple of the exercise rules and other things. So please, everyone, this is a really crucial time for us to stop and slow the spread of COVID in Western New South Wales. Don't compromise yourself or other people by not wearing a face mask, either outdoors or indoors, right across Western New South Wales.
Yep, that's all from me today.
Thanks, Riley. Sam from the Western Advocate.
G'day, Scott. I was wondering if you could provide more information on the 6 new cases recorded for Bathurst today and whether they're linked to, say, the 3 from yesterday or the 5 from Monday.
Sure, Sam. So we do know that the 6 new cases in Bathurst are all linked as household contacts of a person that's in that household with a confirmed case of COVID.
Lovely. And just further on, I guess, these 14-day early lockdown releases, is it fair to say Bathurst, Dubbo and potentially Orange should probably forget about this and focus on the state getting to 70% before they're out of lockdown?
Well, I think vaccination is the absolute priority at the moment. We know that we've got cases in the community that have been infectious in those communities in recent days and weeks. That means there's real potential for further spread. The best solution we have at the moment is to wear all the protections and stop the spread with that, but also get vaccinated. Now, vaccination rates have taken a good jump in the last couple of weeks, but the most crucial thing we can do is get the double jab. So for Pfizer, people that have had Pfizer, that 3-week period is the minimum period that you can have your jab. So please look out for those appointments or make your appointment to have your second dose. And for AstraZeneca, that 4 to 6 week period is the recommended period in our region at the moment. And so please, everyone, the next 4 to 6 weeks is absolutely crucial. We've got to get everyone double dosed up to 80% to enjoy some of the freedoms that will come with that.
But also, of course, Bathurst, Orange and Dubbo have larger populations. It seems like it's going to be a lot tougher for them to go 14 days without a new COVID case until we get to 70% most likely.
Yeah, I think certainly for Bathurst at the moment, there's been cases infectious in the community over the last week and 10 days. So we know that there's real risk of spread with those infectious cases in the community. That's at least a 2-week period before any consideration could be taken to release those stay-at-home orders.
Thanks, Scott. That's all.
Thanks, Sam. Joanna from ABC Central West.
Thank you. I only have one question because my second one was answered already. Mine's in regards to Orange, actually, a little bit further on what you've just been speaking about. Has there been any discussions held about Orange's ability to have either lockdown relaxed or restrictions eased? Been a few days since there have been cases, but very, very low cases, and we're surrounded by areas that are now out of lockdown, or is it just being treated the same way as Bathurst and Dubbo?
Well, at the moment, the last case that was identified in Orange was on the 11th of September. Now, not 100% sure whether that was a case infectious in the community or not, but that's not too long ago. We know that there's been people infectious in the community in the last couple of weeks in Orange, and so can I say to everyone in Orange, please be vigilant. Don't relax your guard for a second. Just because there's communities surrounding Orange that aren't in lockdown at the moment, everyone in Orange should still be on guard that COVID could be creeping around the community anywhere, any day of the week. Please maintain all of the same things to be vigilant: the face masks, hand hygiene, social distancing and QR code checking if you do go out. But stay at home wherever possible. This is the time for us to get on top of it in Orange. And it's clear that in communities surrounding Orange, people have stepped into a level of freedom that I know we'd all love to see. But with those cases that have been infectious in the community, it's still time to be vigilant.
I actually have a second question. I just thought of it, if that's okay. Do you have the testing numbers for Orange and Bathurst to hand?
I don't have the details with me, Joanna, but fair to say they're at record lows, as well as right across the whole of the region. The numbers are very concerning, and so please can encourage everyone right across the region, come out and get tested. This is the weekend for us to get in front of this in Orange. Please, if you've got any signs and symptoms, however mild, then please come out and get tested.
Thanks, Joanna. And finally, Laura from the Canberra Times.
Hi, Scott. Obviously, testing numbers are worryingly low, especially I know in smaller towns there's almost none some days. What's stopping, or what's the barriers to surveillance testing being implemented in more regions more quickly?
So I think we should take that step in coming days and weeks to expand the surveillance testing. We started with the places where we know that there's risk. Risk of further spread of the current outbreak locations, but also risk with the sewage detections going off in the last 24 and 48 hours. Communities like Canberra, I think we absolutely do need to look at as a priority through next week for surveillance testing, and so we'll come back and take stock of that. One of the real considerations here is the capacity of the pathology system, and make sure we can get test results turned around quickly and available for everyone in the community. And so we'll take stock of that over the weekend with the communities we've identified and come back with some further advice early next week.
Great, thank you.
Thanks, Laura. And that's everyone, so we'll call it a day there. I'll get the recording out as soon as we can. Thank you very much for attending.
Thanks, everyone.